for most people, for most dentists, it'll definitely help in the sense that it gives you another tool to educate your patients, right? The way I kind of have a twist on it, and again, because you know me, you know my personality, when I have patients that, know they've already looked it up, they already know what they need and all the stuff. The way I use something like the T-scan, if I want to just take them in a different direction, is like, I'll listen to them and I'll go, okay, I understand that's your diagnosis, and or this is what you think needs to happen. This is what this piece of technology tells me. So you tell me, like, what do you want me to do? How do you want me to do this? And they'll be like, well, what do you mean? You're the dentist. I'm like, well, no, but you're telling me to drive here, but all this other stuff is telling me to go over here. So where are we driving? Are we driving your way or the science way, the right way?
That's your approach, is to put it back in.
Yeah, and I'll ask them, like, what are we doing?
On the spot, and then they quickly realize that they probably don't have any answers.
It's the simplest way. It's the simplest way to deal with people like that. It's just throw the, like, you tell me, how am I supposed to get you here when everything is telling me to get you here?
Right.
Navigation's saying go this way, right? But you're saying we should go that way. So how do I do this?
Right. And you're using your digital tools.
You throw it back at them and go, you're Mr. Smart Guy, yeah.
Don't listen to me walk you through what...
Less is more in any kind of conversation. If I've got somebody whose personality is that they want to, like, argue or negotiate or whatever, I feel like our nature, as especially dentists are, I think we're just such a weird bunch, right? We want to justify everything, and we want to give them lots of data, and we want to support our story and stuff and our facts. Hell no. Just simple. It's like, you want to argue? Tell me how to give you what you want. Like, even something, and I mean, I'm going off topic, so we're not going to use this, but something as simple as, people want a different price, right? They don't like the price. So tell me how to do that. So you ask them a question instead. You don't give them an answer like most of us tend to do. Oh, let me tell you how, expensive overhead is. And hell no. Anytime you justify, they don't hear you, right? So if they have something in their heads about the treatment, I don't justify at all. I come back and say, tell me how that's going to work. How am I supposed to get you there? And they have no answer because they don't know. They just read it on Dr. Google. And Dr. Google didn't tell them how, right? They just said somewhere they read that if you chew on eggshells, it will cure all miracle diseases, right? So let's chew on eggshells. Okay, well then, how do we do that? And then they don't answer. And when they're confused, that's an opportunity for you to shine.